Intravenous injection is an injection of a medication or another substance into a vein indirectly into the bloodstream. It is one of the fastest ways to get a drug into the body. All injections carry a risk of infection and can cause pain, fear, and distress to some extent. They should never be given unnecessarily. The following rules apply for all injections. Always use a sterile syringe and needle. Wipe the top of the medicine bottle with surgical spirit if it is dirty. Always use the narrowest gauge that allows smooth injection of the drug. Wipe injection site with swab with spirit to sterilize and clean. Drugs given by intravenous injection are designated as IV. Ensure that the drug formulation is suitable for IV because some drugs may cause reaction or death when injected by this route. Check that the drug is within the expiry date and contains no particles or contamination. The correct site for IV injection is the cranial third of the jugular vein, where there is less risk of hitting the carotid artery. Always ensure that a competent handler is present and use safe positions when injecting. Ensure all drugs are drawn up ready in syringes and all equipment is sterile. Intravenous injection technique. With a detached needle, raise the jugular vein by occluding it with a thumb at the base of the neck. It should be visible in all but the fattest animals. Insert the needle into the vein and check that venous blood is flowing freely. To know that you're in the vein, the blood flows steadily or even trickles, while artery blood is bright red and flows in sparks. Once satisfied, attach the syringe and inject slowly. Always draw back regularly on the syringe to check that the needle is still in the vein. When inserting the needle, imagine following the line of the vein up the neck. That is, once through the skin, angle the needle upwards and do not insert it at an acute angle. This avoids inserting the needle too deeply through the vein and into the carotid artery. 3 possible complications of intravenous injection. 1. Intra-arterial injection. This causes the animal to collapse before the injection is finished. Seizures, twitching, and coma may occur. 2. Perivascular injection. If the needle comes out of the vein and drugs are injected into the surrounding tissue, local irritation and inflammation may occur, which can damage surrounding nerves. 3. Phlebitis or thrombophlebitis. Inflammation and partial or total occlusion of the jugular vein can occur as a complication of repeated intravenous injections, especially if the technique is not sterile. Prevent this by using a sterile technique and avoiding multiple injections of the same vein. After injections, separate needles and syringes, then store them safely in your kit, preferably inside a plastic container, for proper disposal at the end of the day.